we do thank you for joining this afternoon. We hope this is going to be very informative and helpful for you, and there'll be plenty of time for question and answer session at the end. But before we get started with the actual webinar information about crossing over from intervention to sustainability, I just wanted to take a minute out to congratulate you on your work to date. For some of you, you have been implementing the COMPASS model for a year now, the intervention, and doing such fun work. And I heard another great story just this morning during one of my monthly performance measure meetings, and it was just it's overwhelming, the work that you all are doing to improve stroke care, prevent second events, improve outcomes, improve patient and caregiver satisfaction, and I would go so far as to say, from the story I heard this morning, even saving lives. And on behalf of your hospitals, decreasing readmissions. We're hearing all of that. So I just want to thank you, thank you, thank you. This is not easy work, but you all are doing a tremendous job and a tremendous service to the patients, caregivers, and families of North Carolina. So congratulations. And now it's time to talk about moving forward from what you're doing now in the intervention phase to crossing over to sustainability. And we're going to explain what that's all about just shortly. But Misha, if you would advance the slide, please. Hopefully everyone is on the webinar now, so you can see what our outline and objectives for the next 45 minutes are. We do want to provide you a brief review of the study design and where we are to this point, and Dr. Sarah Jones is going to do that for us. And then we're going to talk about next steps and the expected transition dates, and Misha's going to talk with us about that. And then the three of us will talk about what you can expect in the sustainability phase and what resources you'll continue to have, and so on and so forth. And then we will end with a question and answer session. I would also just invite you, if you have a burning question, if you would just put that in the chat box to Misha, and we will try to answer that as we go, or jot a note, and we'll certainly get to it at the end. So from there, I would like to turn over to Sarah to talk with us about the study design.
Thanks, Sylvia. All right, so as many of you probably know, this is a clinical trial that has kind of two features to it. It's cluster randomized and it's pragmatic. So the cluster randomized part just means that instead of patients being randomized to the intervention that we're testing, we randomize entire hospitals. So all of the patients that y'all treat are getting the intervention because you were randomized to that arm. And then a pragmatic trial has a number of features. One hallmark is that there are broad eligibility criteria, and so that is represented in our design because we're enrolling all stroke and TIA patients that are discharged home, unlike in other trials that have a lot of other eligibility criteria. So that's one of the strengths of this study, is that it's reaching a very broad patient base. We have, oh, can you go back one? So during phase one, which is where you are right now, we have a primary aim, which is to estimate the comparative effectiveness of the COMPASS care model versus usual care. And our outcome is functional status, about 3 months after the stroke. We have a number of secondary aims. Those outcomes are also measured during phase one. They include caregiver strain, all-cause readmissions, 30 days all the way to 1 year after the stroke. We're going to look at healthcare utilization, TCM billing, mortality, a whole list of secondary aims. So that's all going to be achieved during this phase 1 of the study. And Misha, you can go to the next slide. Everybody's probably seen this figure before, but this is our overall design. After randomization, we have our phase 1 allocation. Again, this is where we are right now today. And we are very close to transitioning to phase 2, that's circled on the figure. So you will be transitioning over sometime late fall through early spring of next year to the sustainability phase. And then the usual care hospitals will go through boot camp training and site visits as they transition to implement the intervention. Next slide, Misha. All right, so then just a really brief update on where we are in terms of enrollment right now in phase 1. We have over 4,300 patients enrolled, which is entirely thanks to you and the folks at the usual care hospitals that are doing such a great job in this study. Our goal is 6,000 participants, and we are on track to reach that by the end of our phase 1, which is March of next year. So we're on track and really thrilled about that. And I think this was already covered. I think I'll highlight one other feature of the study design that I think is a great strength, and it speaks to the generalizability of our findings at the end. We have a great diversity of hospitals that are participating. Next slide, Misha. It's diversity across a lot of different features, teaching status, primary stroke center certification, and so forth. And also on this map, you can see we have geographic diversity, north, south, east, west, across the state of North Carolina, and also rural and urban diversity as well. And this really helps generalizability of our findings and inferences to patients across the state, as opposed to studies that are done in just large hospitals or just rural hospitals. Next slide, Misha. Okay, so I think we're going to turn it over to Misha. Are you next? I can't remember.
It's me. I'm ready to go. All right. Thanks, Sarah. So we wanted to let you know, of course, on this webinar, some of the next steps and of course, where we're at with that. So our phase 2 transition will be occurring in 2 waves for our phase 2. So we'll have a wave A and a wave B. If your site is assigned to wave A, then your phase 1 will end on November 1st of this year, and your phase 2 will start on November 2nd. So phase 1 would end on the 1st. We can talk a little bit more about the details of that in the coming slides. If you're assigned to wave B, then your phase 1 is going to end on March 15th of 2018, and it would launch the next day into sustainability on March 16th, 2018. So here's a little more detail on our transition timeline. So of course today we have the webinar which we're describing our crossover plan, and we'll be going into detail on what sustainability looks like. In September, so in the coming days, you'll receive a follow-up memo from this webinar. That follow-up memo will confirm whether your site has been assigned to the Wave A or Wave B group. And then it will also include additional details regarding sustainability. And you'll also have the opportunity during your monthly phone calls to gather more details and have more discussion on sustainability. And then, of course, if you're in Wave A again, your phase 1 will end on November 1st, and you'll start sustaining on November the 2nd. And then if you're in Wave B again, phase 1 ends in on March 15th. You'll get going again on March 16th. So now we're going to dive into a little more detail on how we're defining sustainability. And so I'll start off with the first slide. We'll kind of start from the top. And the way this has been organized, let me see if I can get rid of some background noise. One second, let me get rid of that background noise. Okay. So we're going to start from the top. So we'll talk about screening and enrollment. And basically the way that we have this organized is we'll go through each item and we'll talk about if there's any changes between phase 1 and phase 2. So the first item is patient identification. And there's not going to be any changes between phase 1 and phase 2. And some details on that is that we'll ask that you continue to follow your current procedures for identifying patients. So no changes there. For the screening process, there are going to be some changes. All of the changes, just so you all are aware, we received your feedback and we've been working to streamline everything. So all of the changes have been in an effort to streamline, to make sustainability that much more efficient and streamlined for you. So our screening process, the change is basically going to be that the screening form is no longer required, but it can be used to enroll patients when it is helpful for your site to determine eligibility. So you do not need to complete the screening form for patients that you know for certain are not going to be eligible for COMPASS. However, we are going to continue to recommend that you do use the screening form, of course, when it's helpful for you, and also to track people who you think may go home or have a final, or to track their final qualifying diagnosis.
Can I clarify something?
Yeah.
So it actually is, it is required to enroll a participant, so you can't get to the enrollment form until you complete the eligibility form. But what we're saying here is that if you are transferring a patient out and you know they're not eligible, there's no need to log data entry for ineligibles. I just want to make sure that was clear, but it's still part of the enrollment process.
Gotcha. Thanks, Sarah. Okay, so for our enrollment form, there are some changes there. Again, with the effort of streamlining things, the enrollment form is being shortened. That final version of the enrollment form will be shared with you in October. And just one example of how it's being shortened is that we're no longer collecting caregiver information. So the new version of the enrollment form will no longer have that as part of that form. So no changes on the enrollment process. So you'll continue to enroll patients using the UNC web-based application, and that application is still linked to the eCare application, so no changes there. For notifying patients, again, no changes. So we will still need you to visit the patient in person, provide them the study folder that includes the study brochure, and then if you miss the patient, if they're discharged home before you can get to them, we'll need you to still call the patient and mail the brochure. Or mail the brochure, and we're encouraging you to also call them over the phone. The COMPASS study team will still continue to provide the enrollment folders and materials. The brochure, there is going to be a change there, so we're working right now on updating the brochure to reflect that your site is now in sustainability. So we'll be working with you on that on your upcoming monthly call. One of the items for the next month one-on-one call is to tailor the information so it's specific to your site.
We're also simplifying the blood pressure log and the blood pressure handout that goes into that folder. And, you know, again, as a reminder, we will still be providing those materials to you. Okay, so Sylvia, do you want to talk about the Compass Care Model?
I would love to talk about the Compass Care Model. Thanks, Misha, and thanks, Sarah. This is the fun part. This is the part where you get to work really closely with the patients. You'll continue to do that just like you have been doing in the intervention phase. So with the 2-day calls, there really is no change at all there. We want you to continue doing just what you're doing now, following your current procedures, whoever's making the calls now, for them to continue to do that. And I'm just going to stress again, like we do all of the time with intervention, you know, sustainability is, you know, it's very pragmatic. It's how you will do it at your site, but we do recommend to continue to get your backups in place. Some of you have lost your backups, so it's going to be really important in sustainability, just like in intervention, that you have appropriate backup and adequate backup for when you need to be out. Same thing with the 7 to 14-day clinic visit. No changes there. We want to continue getting the patients back in that 7 to 14-day calendar window. Continue to use the eCare application and creating the eCare plan. And once you do, we want to make sure that you continue to go over that care plan with your patients and any caregivers involved, and still share it with other medical providers, back to that cover letter, back to the primary care provider, and if they are getting home health or outpatient rehab or specialty pharmacy services, all of those places that you now send the care plan, the link to the care plan to. We want you to continue doing that. And of course, when you get the patient back and you generate the care plan, that's what triggers those 30 and 60-day calls. So you'll continue to do those calls. And last but not least, as far as under the direct care model, we want you to continue reaching out to and fully utilizing your community resource networks. You all have done a fantastic job with creating those community resource networks and your community resource directories. We're going to continue to work with you for a while longer to fully get those fully populated, and we want you to use those outstanding resources and relationships that you've built on behalf of your patients and their caregivers. Next slide, please, Misha. And as far as hospital activities, case ascertainment, and enrollment audits, you all have been through those already, and you know the purpose of them. And we will continue to conduct those over the sustainability phase. We will do 2 of those over the course of phase 2. And these audits help you to know that you're capturing, and if you're not capturing, what number and percentage of patients that you've missed prior to discharge and getting them enrolled. So we'll continue that, so it'll let you know, and it'll let us know how your continued enrollment is going, so you can expect those. And then as far as the hospital survey, you might remember way back when, right after recruitment, we worked with you on an initial hospital survey, and we're going to be conducting one in the sustainability phase. It will be shortened, so you'll be happy to know that. And we're working on really what needs to be in it. It's going to be tailored more to learning from you all as what it took to be successful, what ongoing help and support would be helpful to sustain this model. We've got a core group of us that are working on questions that will be very helpful for you all to answer, but we promise it's going to be a lot shorter than the first hospital survey that you did. So from there, I'm going to turn back over to Sarah to talk about patient outcome assessment.
Sure. So we will be continuing patient outcome assessment in phase 2. And so we will continue doing the reminder letters that are sent from the UNC team at 30, 60, and 80 days post-stroke. And we'll continue doing the telephone survey calls at about 3 months. What we are not going to do anymore is the caregiver survey. Did everybody else just lose their screen? Maybe it's just me.
I still have mine, Sarah.
Oh, okay. Well, I know what the slide looks like. So the caregiver outcome, the secondary outcome, is only being assessed during phase 1, and because we're not assessing it in phase 2, we won't be collecting caregiver information on the enrollment form, and we're not going to do the mailed surveys to caregivers.
Were you able to get your screen back, Sarah? I can.
No, do I have another slide? Sorry, it just went off the screen. Just my luck.
Okay, well, let me pick up this slide. So we wanted to also let you know about ongoing support and training, and there are some changes there. So the Compass Study website, you will still have access to all of the Compass Study resources and any additional resources in the future that are posted. We did want to let you know that the change that's going to take place is we're going to actually make the Compass Study website open to all users, so it'll be open to the public, and that's going to be taking place in April of 2018. So the change is that you would not need to log in to obtain access to the intervention resources. As far as webinars going forward, so a change there. We will not be hosting any ongoing training webinars for you during the sustainability phase. However, as you know, a lot of those webinars do get posted to our website, and you're welcome to go to the website and review any webinars or new materials that are posted. One-on-one calls with Sylvia and Rika and sometimes others. We will not be hosting those monthly one-on-one calls any longer. And also during sustainability, the point of contact is going to change. So during your phase 2, we'll ask that rather than reaching out to Sylvia and Rika like you have during phase 1, that you reach out to Lori Medham, who is going to be your point of contact during the sustainability phase. So that will go into effect on the date that you transition over to sustainability. And then there's no change in the monthly performance reports. Those monthly performance reports and graphs are going to still be uploaded to the Compass application on the same schedule, so it'll be uploaded monthly. And we certainly do encourage you to continue to access those reports and share them with your team to facilitate continued improvement. So I think everyone is aware that during the sustainability phase, the Compass Study financial incentives will no longer be part of the sustainability. So the $50 for enrollment and the $105 for completing the clinic visit, which is defined as completing that 2-day follow-up call and then also generating the e-care plan. Those are no longer going to be compensated by the Compass Study. And the last thing we wanted to touch on as far as details for sustainability is a slide on compliance. So since we're still conducting research at your site, there's not going to be a change with IRB. We're going to continue to maintain IRB oversight for the research at your site. Our protocol is currently under draft. Right now we're working on updating our protocols, and so we'll be putting in an amendment, and that amendment will go in early September. So under personnel, so no changes there. We still want to know when there's any changes in your study personnel. So please keep us informed there. Of course, your main point of contact will be Lori going forward, and so do let her know if there's any changes in your team. For research training, again, also no changes. We do require that research training for any team members who are entering patient data in the data application, or if any of your team members are conducting patient consent during the clinic visit, they'll need to have the research training. We touched on this earlier, but patient notification, so no changes there. We still want to let our patients know that they're being enrolled in the study and that they're going to be called at 90 days and asked to participate in the phone survey. So we're still providing them the patient brochure, hopefully in person, but if not in person, then by mail. We will still have the 1-800 toll-free number for patients, so we'll continue to monitor that, and that'll be a resource, of course, for any patients who have questions or who want to opt out of the 90-day phone call. And then again, no change on notifications of any concerns. As many of you know, this was a request from our DSMB. So during the sustainability phase, if you have any concerns or any potential concerns about patient safety or security, we do want to know about that. So please continue to send those forward. You can send those, of course, to Lori or really anyone on our team. And we will continue to log anything that comes up and report those to our DSMB and IRBs. All right, Sylvia.
So thank you again, Misha and Sarah. And we do want to thank you before we start the question and answer session and just tell you how excited we are to continue to work with you throughout the sustainability phase. And I just want to say that you are going to be in such capable and caring and competent hands, with Laurie being your point of contact. Some of you have worked with her already on data issues and technical snafus and that kind of thing. So you know she's highly responsive. Many of you, like I, have worked with Laurie for years, and so you'll be well taken care of. It has been a true honor and privilege for me to have the opportunity to really be integrated into each of your teams. And so honestly, this is probably really, really good because, you know, this Misha went over the things, and Sarah and I went over the things that will change and some that will not change. So because I feel so integrated into some of your teams, I might be, you know, I might be caught cheating, if you will, and helping in areas that maybe I shouldn't help in. But I do want you to know that I'm not going away. So Laurie will be your point of contact, but keep the good stories coming because our team is going to continue to splash those stories as we talk about a lot during our monthly individual site-specific meetings. Those stories, you know, the data is critical. The percentages and the numbers and the rates and all of that are so critical to the study. But the stories and the whole implementation science that we're studying is so critical as well. And we're also going to be writing about your stories and how to be successful with implementing this model. So please keep those coming. And we do appreciate everything that you're continuing to do in the intervention phase and moving towards sustainability. So I want to stop there and see if there's anything that anybody else on our team would like to add, and then we're going to open up for the question and answer session.
So this is Rika. I actually don't have a comment, but it's more of a question that I have.
Okay, Rika.
So I see that they will no longer be having
one-on-one check-in calls with me and you, Sylvia, that the monthly performance measures and graphs will still be posted on the data application for them to look at. However, some of the other items they get from us is, you know, they're missing a disposition form, or maybe they're missing a consent, those quality items that they get from me. Will they still be getting those from me when they hit the sustaining phase? Because I don't see that mentioned in here, so I was just wondering.
Yeah, it's my understanding that you all will continue being able to pull down, just like you do now, straight from the app each month, your performance measure reports that we go over, and those graphs, the 3 graphs, the one on the 2. Yeah, but that's it. That's it.
So the quality data, like if they forget to do a consent, if a discharge date and the 2-day phone call, there's a discrepancy, we're not concerned with that?
Well, we're concerned, but it's my understanding, and Sarah, you can jump in here, but we're not going to be providing that additional information nor discussing it on a call.
That's right. Some of the document with the figures does have some data quality measures on it, and that will remain there so that you can be aware of some discrepancies in data entry. And as it relates to consent, if it's an IRB issue, we may reach out to you about something like that, and that would be funneled through Laurie. Does that make sense?
Sarah. Great question, Rika, and thank you, Sarah, for finishing that response. Other questions? Well, just the floor is open now for questions from everyone. And Misha, I assume that maybe you've unmuted everyone. And once she unmutes you, if you are not speaking, if we could get you to mute just so we can minimize background noise and everyone can hear.
So I have unmuted everyone. It looks like there's a few individuals out there who are self-muted. And it does look like we got a question from Robin Jones. Robin, do you want to see if you can speak, and we'll give you a second, and if you can't, then I'll read your question out loud.
Hi, Robin. Are you able to unmute yourself so that we can hear your special voice out there and hear your question? If not, Misha will read it. I can't see that from my screen.
Okay, so I'll go ahead and read it. So Robin wrote, do you anticipate the office visit time will reduce due to no caregiver survey? So
excuse me, I missed part of what you said, Misha. Could you please reread that?
The question is, do you anticipate the office visit time will reduce due to no caregiver survey? And it sounds like Robin might be thinking of the caregiver assessment during the 7 to 14 day visit.
That's
so
how it sounds, yeah, and we would continue. If it's triggered, that will continue. The caregiver assessment during the clinic visit would continue to be triggered. It's the caregiver survey that we mail out at that 80, 90-day period that we ask caregivers to complete and mail back to us. That's what we will no longer have in phase 2.
And her follow-up question was, has the Wake Forest site tested the sustainability model?
Well, I would say that we are sort of in that now. I don't know if we're actually calling it that, but we, as you recall, we started with the Vanguard site, the Wake Forest Baptist Medical Center site, 90 days out ahead of wave 1, and so their year is finished and they're continuing to plug along, and they actually do not get additional support from our team. They don't get the additional financial support already. So Misha and Sarah jump in on answering that question as well.
I would agree with that, our Vanguard site has been ahead of the game several months before y'all, and that they're a part of the sustainability. Our methodology committee really voted on some of the specifics of sustainability. We're not seeing that any of these changes are so major that they're really just refining what you already have been doing for the past year with just a little less hands-on support from our team.
Thank you, Misha. Other questions?
Yes, can you hear me? This is Rhonda from University.
Yes, I can hear you, Rhonda.
Okay, I just have a question that's probably not that important. It's just more of a curiosity. Why were the days to end or have the transition from, you know, November 1st to November 2nd or 15th to the 16th of March in the middle of a week or during the week? I would think maybe one would be a Friday and start on Monday. Is there a reason for that, or?
That's probably, to give you the scientific reasons, probably a Sarah Jones answer, but I think we were just looking at months more than like how the week was segmented, but just looking at the number of months and that time frame. And, and then our timeline with PCORI, I think, is driving in part the waive fee, the March 15th and 16th dates. But Sarah, is there anything else you would like to say about that?
Sure. It's probably overly technical, but we have projection algorithms that are by hospital. So what we do is we project out our predicted enrollment in the future based on previous rates of enrollment over time. And so those dates came from when the projections indicate that we will reach certain milestone targets for enrollment.
All right, that's a good answer.
So yeah, I mean, it would have been nice maybe we had rounded them off to Fridays or something, but we stuck with what the computer algorithms were telling us.
Okay, no big deal. Thanks.
Good question.
Thank you. It is a good question. Other questions that you all have?
This is Denise. I have a question.
Hey, Denise.
You may have talked about it during the presentation, but I wasn't real clear. Does the patient still have to sign the consent when they go to the visit?
Yes, we do still want them to complete the consent at the 14-day visit.
Okay, because I always talk about that with the patients when I see them in the hospital. I didn't know if I was supposed to continue saying that afterwards, but you clarified that. Thank you.
Yes, ma'am. Other questions? See, we're just getting warmed up now, so don't be shy. And I know you probably do have some questions. And you will continue to have questions. You know, you're probably in the thinking phase right now too, and we are too with our team. We had a very important methodology committee meeting on Monday where we finished answering some questions about how we're defining the sustainability phase, and some of the information that was presented today we just made final decisions on. So this truly is hot off the press. And so as you continue to think about this and continue to move through the intervention phase, we'll continue to talk about this. We'll have time on our monthly site-specific calls. We've been talking about it a little bit already in as much as we knew up to that time. But this is the official, and so please, you all are representatives from your site. Some of you have more than one person with you, but some of you are the representative for your site. So we do want you to take this information back to your teams, share it with them. We'll share the slide sets. We'll have the webinar is being recorded, so we can share that with folks who could not be with us today, and just continue to make a list of your questions. And for now, I will remain your point of contact. And so just as always, feel free to call me, email me, and we'll talk when we have our scheduled as well. But we've got 5 or 6 more minutes. Anything else that is top of mind or burning that would be helpful for not only your site, but usually if it's helpful for your site, it's helpful for everyone. So please ask your questions. Well, Sarah and Misha did an outstanding job of going through the material, so I know it was clear. But again, you will probably, as you think more about this and huddle in your individual teams back at your specific site, you may come up with questions. So as you do, don't feel you need to hold them. Make sure that you go ahead and share them with us. And as Misha said earlier, we will be sending out a letter soon that will let you know whether you're going to be in Wave A. And remember, Wave A will stop enrolling patients in the current phase November 1st and cross over to sustainability in the 2nd. And then for those of you who will be in Wave B, you'll continue on with the intervention just as you're doing now until March the 15th, and then you'll cross over on the 16th. So it gives everybody plenty of time to be thinking about how they're going to move forward with sustainability. Anything else come up that you want to ask?
Can you hear me now?
Yes, I can hear you.
This is Robin.
Hey, Robin, I can hear you now. I can finally hear you. This is
We really are here.
You really are. I knew you were. Always are.
So one question I have, and this can be something we could even email answer back and forth about, but I'm just curious if any of the other sites are looking at truncating their office visit during sustainability based on the fact that there won't be, if I understood correctly, there will not be that caregiver interview piece to the e-care plan.
Now that again, Robin, is we're talking about the caregiver survey that comes out at that 90-day period. Okay. You still will have the caregiver assessment will get triggered.
Okay, very good. Okay, we did not understand that, but thank you. That clears it up.
Absolutely, absolutely. Now, and if there are other, we're going to be talking, we're going to be spending, that's a good segue into what we're going to do some in September. Misha mentioned that we are going to tailor your sustainability brochure, and by brochure we mean that one-pager that has your hospital name and logo on it that goes in the folder, in the discharge folder. We're going to be working with you in September during your site-specific calls to find out what needs to go on that brochure. And we'll be talking more about that. We're going to tailor it to exactly what you're going to be doing at your site, and let you read the proof, look at the proof before we print. So we will be doing that at the September site-specific calls, when we talk about the performance measure reports and the graphs. And we always spend time talking about anything else that's going on at your site in particular. So Rika and I will be working with you on those brochures during those monthly calls in September. Any other questions? It's all been excellent questions, and I'm sure the answers have helped everybody else out there too. Well, we're
Is the
down.
wave A and the wave B randomized?
They really are based on how many patients have been enrolled at this point, and in comparison to what would have been anticipated to have been enrolled at this point. So they're not randomized. It really is based on enrollment. Does that answer your question, Robin?
Yes, ma'am. And we just wanted to say thank you to the Vanguard site for their support during this year one, and to the Compass leaders, yourself and Nisha, everyone included. This has been a tremendous experience to be a part of, and we wanted to say thank you back to you.
Well, thank you so much. We take that very personally and very honorably. It's been really, I mean, this, as we have said all along, from boot camp, site-specific visits, this truly has been a journey, and we've learned as much or more from you all as you have learned from us, and we will continue to do that. And so we just really appreciate your ongoing commitment to improving stroke care and your passion for doing that, and all of the help and support that you give not only us, but you give each other through the aggregate calls and the emails and all of the ways that you help and support each other. So thank you for that, Robin. I have that we are nearing the top of the hour here, and I just want to see if there's anything any of my Compass teammates want to say in closing before we adjourn. We want to be respectful of your time.
Thanks, everyone, for your time.
Thank you, everyone. Have a good rest of the day and long, safe Labor Day holiday weekend. We will be in touch.
Thanks. You too.
Bye-bye.
Bye.